Request you to please take your seats so that we can continue. Thank you. Our next session is titled Clearer Vision, Brighter Futures, Addressing the Presbyopia Gap. It is my pleasure to welcome Dr. Indu Bhushan to deliver the keynote address before the panel discussion. Dr. Bhushan is a distinguished Indian bureaucrat and economist, renowned for his role as the first CEO of Ayushman Bharat, which, as we all know, is a landmark Indian government initiative providing healthcare coverage to the country's low income population. It is my privilege to welcome Dr. Indu Bhushan to deliver the keynote. Over to you, sir.
Wait for people to come, or should I start? You start, right?
You can begin. I think
people will come.
the mic is on.
Okay. So, good morning, everyone. And thank you very much for inviting me to Charcha 2024. And Atul is not here, but let me also compliment Atul and Amit for getting such a galaxy of speakers over last 3 years. And I was just part of the last session, which was so stimulating. But also the kind of issues, policy relevant issues that you have selected for discussion is really amazing. And it is indeed my privilege to be part of this Charcha, but also being among such esteemed thinkers and policy makers. I'm also deeply honored to be part of the launch of the report today, this Clearer Vision, Brighter Future, addressing the presbyopia gap. This report, I've provided foreword for this report and read it page to page. And it's not just a collection of data, insightful analysis, and practical recommendations. It stands as a beacon of hope for millions of Indians whose lives can be transformed with something as simple as and as profound as a pair of glasses. I want to start by sharing a personal story from my childhood. I grew up in UP, in small towns that make the heart of the state. And when I was young, about 6 or 7, one of my distant aunts started to live with us because she was going through some problems in her family, and she stayed in our outhouse. She was a very proud woman, and she wanted to stand on her own feet, not be dependent on my parents. And she tried her hand on many things because she wanted to earn herself. But unfortunately, none of the vocations she tried worked. One day, my mother reminded her that, when you were young, you were really good in sewing, knitting, weaving. Why don't you pick up something from that on that side? I can still see the sense of disappointment on her face. I could still recollect that. And she said, yeah, Sashi, I was very good, but now not anymore. I can't now even weave. I can't I can't thread the needle still. And I'm out of practice. I really can't do that anymore. But it turned out that it was not that she was out of practice, but it was that she couldn't see. She couldn't see up close. And so my mother decided to take her to a doctor and got her just a pair of glasses. And I can tell you that with the simple act, everything changed. My aunt not only revived her skills, but she had a thriving business. She became the go-to person for the entire neighborhood for making sweaters in the winter, school uniforms in summers, and mending clothes all year round. So, my aunt's story is actually a vivid illustration of silent yet profound impact that corrected vision can have. Presbyopia doesn't discriminate. It affects teachers who can't no longer see fine prints in textbooks, farmers who struggle to see pests on their crops, and artisans whose work demand meticulous attention to detail. Though I'm a public health professional myself, I take pride in that, but it was only when I was nudged by the Nudge Institute that I understood the staggering scale of the problem. This report that we are going to be launching today estimates that uncorrected presbyopia could be costing the country as much as $14 billion in lost productivity every year. And in fact, this is not just a number. It represents millions of stories like my aunt's, families struggling to make ends meet, and communities missing out on full potential of their skilled workers. Addressing this issue, of course, is not without challenges. If it was easy, we could have done it long ago, right? So there are significant barriers to effective vision care. Most people, especially in rural areas, are unaware of the problems that they're facing. They think that's a normal aging process. They hold misconceptions that discourage them from wearing glasses. And there are also cultural stigmas which complicate the issues. They associate wearing glasses with Western practices, leading to resistance until the conditions become much worse. So, access to affordable eyeglasses is also a major challenge in rural areas. Most eyeglasses are sold in expensive urban optical shops, requiring rural residents to travel to cities, incurring high costs and lost wages. In addition, the logistical and legal difficulties in distributing eyeglasses in rural areas in mass scale is also a big problem, as has been identified in this report. In the government, we have a long-standing program called Control of Blindness and Vision Impairment. This program has been running for several decades, but it's largely focusing on cataract surgeries, and more than 50% of its budget is actually unutilized every year. So we have a large number of barriers, but despite these barriers, expanding vision correction services is achievable with right policies and support from both public and private sectors. This report has documented several successful initiatives such as Kanti Velugu in Telangana, YSR Kanti Velugu in Andhra Pradesh, Asha Kiran in Karnataka, and several others by civil societies. And these programs have overcome challenges and provided effective vision care to their populations. And of course, there is a lot of learning that we can do from these programs. Actually, one inspiring example comes from the program in rural Andhra Pradesh, where local women were trained as vision ambassadors. One ambassador, Geeta, helped over 500 villagers regain their sight within a year. Her work not only improved the lives of those people that she served, but also provided her with a stable income and sense of purpose. Stories like Geeta's demonstrate the incredible potential of empowering communities to take charge of their health and well-being. By integrating vision care into broader health and community program, we can overcome access barriers and ensure that no one is left behind. And the report also provides a practical plan to address the unmet need for reading glasses for 150 million Indians. Achieving this will require addressing large-scale distribution, unlocking funding, and building domestic manufacturing capacity. The report convincingly argues that this goal can be achieved within 8 years, within short time of 8 years. It needs appropriate policy changes, It needs allocation of resources from existing budget itself, and leveraging, most importantly, leveraging the extensive community network which has already been established by the government. In fact, the report argues that if we redirect the unutilized budget of National Program for Control of Blindness and Vision Impairment, only that unutilized budget, we can meet this unmet need within 7 years. Of course, we need a clear and well-articulated strategy, and we need to do, of course, 3 things. One, we must demedicalize eyeglasses, making them accessible through non-traditional channels such as local shops, community centers, and schools. By doing so, we can deliver and we can reach a wider audience and reduce the stigma associated with wearing glasses. Current regulations actually don't require medical prescription for buying glasses, but government programs actually don't follow that. They mandate the medical prescription. This is creating a gap between regulation actually and intent of the program. Second thing that we need to do is to invest in awareness programs that educate people about this problem, importance of vision care, and dispel myths surrounding eyeglasses. These campaigns, of course, should be culturally sensitive and tailored to specific needs of society or communities, because these myths vary from community to community. And third and last thing is that we should effectively leverage our healthcare infrastructure and grassroots community workers, especially in rural areas. So collaboration between health sector and other sectors, including programs run by ministries of social justice, Ministry of Rural Development, is critical. And we also need to train more optometrists, equip them with necessary tools, and ensure that they can operate effectively in remote locations. And finally, the role of government and civil society is crucial in this endeavor. Government can enact policies, they can provide resources, they can mobilize their infrastructure, and civil societies can help in terms of providing expertise, creating models that can be scaled. As we move forward, let's remember that our mission is not merely about distributing eyeglasses. It is about restoring dignity, reigniting dreams, and empowering every individual to contribute fully to our society. It's not just about correcting vision, it is about correcting a fundamental inequity that has held back millions. I firmly believe that providing vision care to all Indians is not just a dream, but it is a highly achievable mission. By working together, we can make a difference in the lives of millions of people. Let's ensure that stories like my aunt's and Geeta's become the norm, not the exception. We can easily turn the tide and unlock the full potential of our nation's workforce. Thank you for your attention, and thank you again for inviting me.
Thank you, sir. Could I request you to stay on stage? Thank you very much, sir. Thank you for also bringing your personal stories into it and emphasizing that it's not about vision, it's about dignity and livelihoods. It is my pleasure to invite Amit Gupta, COO of the Nudge Institute, up on stage. He will be the moderator for the next session. I also invite the panelists, Abigail Steinberg, Executive Director of the Eyeglasses Initiative of the Livelihood Impact Fund, focused on providing reading eyeglasses to 800 million people who need them. Ella Gudwin, who is the CEO of Vision Spring. She is a social entrepreneur and global health strategist with more than 25 years of experience in international development. Narasimhan Narayanan, who is the president of Essilor Luxottica South Asia. Prior to joining Essilor Luxottica, Narasimhan worked in General Electric, Microsoft in various roles. Peyush Bansal, he's the man behind Lenskart, one of India's biggest e-commerce portals in the optics and eyewear space. A warm welcome to our panel. It is my request to the panel to hold up a report that has been compiled by the Nudge Institute. It is titled Reading Glasses and Livelihood, Challenges and Pathways to Scale Access in India. Thank you very much. A QR code is, I think, available on the side panels for you to download a copy of the report. We request you to do so. Thank you very much, and over to the panel. Thank you, Amit.
Good morning, everyone, and thanks for being here. And thank you, Dr. Bhushan, for your continued support and guidance and the keynote. As he laid out that this problem is immense in India. It's a very simple tool and technology and has been around for centuries. Even if you'll take a very conservative estimate, there are about 150 million people in India who have uncorrected presbyopia. And backstage we were talking that this number sounds low for India, and it may in reality be as much as 300 million. And the problem is that there's no credible way to enumerating it yet. But even if we'll go with this 150 million number, and we take that as a base, and we apply it to all the different occupations which require a very good near vision, there are about 70 million people in India who don't have eyeglasses, reading glasses, and because of that, they can't do their job properly. And actually, many of them exit the workforce earlier than they should. Cumulative impact of that, based on this, is about $14 billion. It's a technology which is seven centuries old. That's a whole lot of money to pay for such a simple and old technology. So I think that reading is a very narrow use case of these glasses, and reading glasses actually is a misnomer in Indian context. We should call it something else, maybe a productivity magnifier, or as Ella likes to call it, earning glasses. So with that, let me, Ella, start with you. Vision Spring has been doing great work in India and in other countries. Based on your on-the-ground work, I know that you have run studies in Bangladesh and in Assam. Can you talk about that study? You know, what was the outcome? And in general, what has been the socio-economic impact of lack of access to reading glasses to poor population?
Okay, great. Before we talk about numbers, I'm going to ask everybody to get up on your feet. Okay, stretch, good morning. Okay, good. Okay. If you know somebody who wears glasses, raise your hand. I think everybody? Okay, good. 100%. If you have somebody in your immediate family who wears glasses, raise your hand. I'm at 99.5%, right? Almost everybody. If you are wearing glasses now, please stay standing. If you have contact lenses or you got LASIK, also stay standing. If you are not wearing glasses, you can sit down. Look at all our beautiful people. You look stunning. You're so beautiful with your glasses. So this is about, what, 55% of the room? Little more, maybe 60%. And this is a young room, okay? So if we were an older room, we would have more glasses. You're all looking very nice. Okay, now, if you got glasses as a child, take your glasses off. I want you to imagine if you would have your job today and your education today if you did not have your glasses. Imagine being in this Charcha Hall without your glasses. You are Sustainable Development Goal number 2. You are glasses taking you on a path to greater educational outcomes. Okay, stay standing. Keep your glasses off. If you got glasses as an adult and you need them, especially maybe to read your mobile phone, maybe you need them to read the menu in low light, maybe you need them to read your computer, maybe you're an Excel whiz and you need them for your Excel spreadsheet, take your glasses off. Is anyone still wearing their glasses? You're still wearing your glasses. What's your use case? Why do you still?
I can't see the distance.
When did you get your glasses?
About 15 years ago,
Okay, but were you in school or were you working?
I had just passed out of my school.
Okay, you take your glasses off. You were probably using them for your Excel spreadsheet. Okay, so I want you to imagine now the innovation, the income, the productivity that would be lost. Oh, we still have one person with her glasses. She can't take them off. Would you like to take them off for 2 minutes? Great, okay. Now, you still have your glasses on. Okay, but take them off. Take them off. I want everybody who has glasses to have them off. Okay, why am I asking you to take your glasses off? Because I want you to imagine 500 million people in India who are just like you right now, trying to earn a living, trying to succeed in school, trying to drive safely on the roads, who need glasses and cannot and don't have them. They are like you right now, in need of vision correction with no glasses on their faces. This is a problem that we can all change. And there is a magic to this problem because the correction is immediate. Put your glasses on. It's magic. It is everyday magic. You just went from not seeing to seeing. So we can do this for all of India. It is a 700-year-old technology. India can be a clear vision nation. And that is how we're going to grow at 9%. And that is how rural communities and poor households will chart a path out of poverty with much greater likelihood. Okay, thank you for joining me. You can sit down. So now what I want to do is just put the number behind the study for a minute. So we all could feel that. We have now done some randomized control trials that will put some statistics behind the experience. The first studies came out of Assam. We were working in the tea gardens. To the point about reading glasses being a misnomer, you might know that to make those beautiful cups of tea, I think Darjeeling calls it the champagne of tea, you have to pick 2 leaf, 1 bud, 2 leaf, 1 bud. This is very intensive near vision work. We provided reading glasses to the tea pickers, and their productivity increased on average by 22% kilograms of tea picked per day. And for the women over age 50, because the majority of the tea pickers are women, the productivity increased by 32%. That means they're also hitting their incentives and they're hitting bonuses. Now, we did another study that we just released, and additionally a randomized control trial. And this study comes out of rural Bangladesh. In rural Bangladesh, we dispensed reading glasses with community health workers, not ophthalmologists. Why? Because reading glasses are just magnifiers. They are an over-the-counter product. They do not need a doctor. So we had community health workers dispensing reading glasses. Average age of the recipient was 47. Average monthly income at the beginning of the study was $35 a month. So this is a wide range of rural occupations. Farmers, artisans, shopkeepers, skilled tradespeople. And after they were wearing their glasses, we went back 8 months later, and they reported a 33% increase in income. Their income went up by 1/3 with a 700-year-old technology. Tell me a technology or a poverty intervention that can produce income gains for less than $3 and can extend somebody's working years by a decade. There are very few. And this one is in our reach. And so now, whenever you go into the communities that you work in, you will always see that glasses are missing on somebody's face. And you will know that that person will have the opportunity to increase their income by 33% if they just had a simple pair of glasses.
Thank you, Ella. I don't think anybody can make that point better. And I don't think that we need any fancy RCTs for that. You have demonstrated the impact of reading glasses. Abby, let me come to you. Eyeglasses is a global initiative and one of the key areas where Livelihood Impact Fund is working. So can you speak on some of the financial barriers you see to scale the access? Maybe you can elaborate what is your investment thesis, not only for the first pair, but for the subsequent pairs also.
Yeah, pleasure to be here. That's a hard act to follow. So we at Livelihood Impact Fund, we want to meaningfully and durably improve the lives of the global poor. And when we stumbled on your incredible research on increase in productivity and income, we said, wait, if we can increase productivity and income by 20, 30% with a pair of spectacles that can charge, under 80 rupees to purchase a pair, we said, why doesn't everyone have them? And 700-year-old tech that's safe and effective to self-select and has wide range of use cases. And the more we look into it, the more we realize how near vision really impacts income. So a cocoa farmer, for example, I think most of you probably like chocolate, if they hand pollinate an intensive near vision task, their yield can go up by 30, 40%. I'd love more cocoa in the world. I'd love more tea in the world. But I'd really love to move individuals out of poverty, keep them employed longer, improve their dignity and their welfare. And the last panel was on villages and improving the livelihoods there in the community. And this is a product that could do so. So we looked at it and we turned to Vision Spring, one of our wonderful partners, and we said, how big is the problem? Why is this persistent? Why do so many people not have access? So the problem globally is about 1.8 billion people have presbyopia, undercounted. It's about 90% of people above the age of 35, 40. It's natural form of aging, so it's going to affect everyone. And in many countries, it's over the counter because it's just a simple magnifier that cannot harm the eyes. And the more we looked at it, we realized there's a latent demand issue. So many people don't even know they have it. I gave someone in a business meeting the other day, he was holding the paper too close, and I just handed him a pair of plus 1.5, and he was like, oh my gosh, I guess I've been doing this for way too long. So we see people across the education spectrum that really don't even realize they have it because it's so gradual. So there's lack of awareness, there's all these misconceptions, there's stigmas that vary by rural, peri-urban, and urban areas. There's concerns around cost, and there's shame around it. So people say, well, if I go into a store, it's going to cost something to get screened for presbyopia. And screening, by the way, is a simple piece of paper. And in many times, you just kind of just put a pair on and try them on. And then they're concerned about the cost of the product itself. And so there's those challenges. And then there's very few access points that are affordable and consistent. And so the more we began to talk with Vision Spring and the Nudge, we realized, wait, if we can get them into the hands of even a percentage of the individuals who need them, maybe 20, 30%, there's a tipping point in this product. It turns out that people get addicted to seeing. And in some cases, they might have sold themselves to you. So how do we deploy them effectively through channels that are already reaching the individuals that need them, safe, trusted channels, get people into their first pair, and empower them to seek out a second pair, either through public service points or through private market access. And what's exciting here is that there's a huge, population of people who will purchase them and will go on to purchase them. And we know many people go on to purchase them for 40% more than their first pair. So there's an untapped market potential here as well. So very quickly, our investment thesis is, How do we get them? How do we saturate communities 20, 30%, reach those individuals in need, begin to normalize it, address some of the stigma, create awareness, do demand gen, and also provide both public sector access points and private sector access points?
Okay, thank you, Abby. So, Peyush, let me turn to you. So, once that 20-30% access has been provided, and if we have to scale it further, what kind of supply chain issues you see which will hamper us to make it to 100%?
Thanks. So honestly, when we were first doing the call, I always used to think that presbyopia is an easy problem to solve, so why spend time on it? And I was too focused solving for myopia at Lenskart, and even now, whatever work Foundation does, I realize that presbyopia is a big problem. I mean, of the 500 million, I'm assuming 100 million would be presbyopic.
Oh, we think it's closer to, it's the minimum
150.
Minimum 150,
Yeah.
and it
Probably
could be
300 million.
could be as much as 300.
Yeah, and then, after our last call, then I went back to our team and understood how much are we selling reading glasses for, and then you on the call said, I told you that in the foundation we are giving it free, but you said people are comfortable paying 100 rupees for it, right? And it is doable. And then I spoke to our supply chain head, and I asked him, can we make this in India, and what will it cost us? And I think what we figured out is that ideally if we sell it for 100 rupees, we can be break even on this, right? So you can make the frames, you can put the lenses, and then there was a supply chain cost that we said is big. But assuming we are able to leverage into the existing distribution centers, I think it can be supplied. But I believe the problem is more than just the supply. It is also awareness about it at a mass scale. I believe there are shops selling reading glasses very affordably in India even today. May not be Lenskart, but there are other opticians that are available. While I'm not saying India has the maximum access compared to other parts of the world, but we are getting there. At least, like, before we go to remote parts of the world, of India, I would say even in metros there'll be enough people who are not getting their reading glasses, right? And maybe when your prescription is +1, you can avoid it, and when you get to +2, so even in that 150 million, I think 75 million would be decently, compromised in their vision. Even if I assume if you have a +0.5, +1, you are managing. I'm assuming the average is 30, but the people who are at +2, +2.5, their productivity may go up by even 50%.
I can tell you, I just got up to 175, and I'm now useless without my glasses.
Yeah. So I think, yes, there are supply chain constraints, but they can be solved. I think even if I didn't know the problem is big enough, and I am in this industry for the last decade, then I'm assuming that people who are not in this industry don't know of the problem. And I mean, I'm saying even if there are 150 million people who need glasses and a pair of glasses cost $1, that's $150 million. That's not a large sum of money. I think we spend that kind of money in various other activities today in India. So it's not a question of investment. I think it's a question of are we really getting down to do it? I think supply ecosystems are also getting built in India. India is now manufacturing frames, multiple people are doing it, we are doing it, but it is possible. I understand if you have to bring them from China, logistic cost, it can be expensive. So I think we are there yet. I think we just need to become more conscious. People like me need to become more conscious about it, to be honest. And if we want, we can do it. And hopefully this charcha will lead to something interesting. I mean, to be honest, we haven't done much, but if across Lenskart stores we enabled a pair of reading glasses for 100 rupees and we didn't make any dollar on it, there's nothing better that we can do for our existence, right? I mean, we have enough going for ourselves that we can enable that. So let's see if we can do something here.
I'm drafting an MOU right now.
Piyush, if I can have a quick follow-up on that. So in urban areas, you had a very innovative distribution strategy, started online, then it's an omni-channel approach. So manufacturing and getting the glasses in 100 rupees is one problem, but you talked about distribution as a channel, as a problem as well. So if we were to go to rural areas, and our estimate actually suggests that about 85% of these people actually are in rural India, not in urban India. So if we were to reach to them, do you see e-commerce as a means to reach them? Do you see any other existing distribution channel where market players can viably partner and hence provide solutions?
See, I think in rural, the bigger problem is then distribution is getting them to do an eye test, right? At least in the foundation, I have seen that people don't get out of their homes. So you need to get to their home, and it doesn't require fancy equipment. You can just ask them to read, and you'll know whether they need a pair of glasses, and you can, fortunately in this one, you can just put it and the magic happens. I think that's the larger problem. Today, the logistics ecosystem is good enough in India that 100 may become 110 or 120. It's not going to be that difficult. I don't see people ordering on e-commerce. It really depends, rural. Yeah. Tier 2, Tier 3, I think it's okay. But I think the larger problem is people are not getting out of their house. I know in the Drishti Didi project that our foundation runs, there are 500 villages that we cover. But in all those 500 villages, we have to go to the house. It's not like we are putting a camp in a nearby chawl and people are coming for the eye test. I often ask my wife, why is that not happening? It looks logical. But she said that women don't come out of the house, people don't come. So they actually go house by house, knock the door, make them read. It's like, vision is yours, but it kind of is this. But I think it will change. There will be an inflection point when people will become aware. But till such time, I think if that happens, distribution can be sorted out.
Okay. Thank you. Nara, let me come to you. So when it comes to getting people out of houses and getting them tested, I think SLR has been running a very good program called iMitra since 2013. So can you talk a bit more about that program? And in general, can you talk about micro-entrepreneurship as a model to scale? And if we plan to, let's say, create 1 lakh, 100,000 iMitras across the country, what are the enabling factors needed?
Thank you, Amit. Yeah. So back in 2013, when our foundation said, hey, let's significantly scale up our mission activities in a couple of countries, including India, at that point in time, what we said was, let's first assess the problem on hand, what we have. So to the panel, what they mentioned, we found that out of a population of, now it's 1.4 billion, around half of the people needed correction. And out of the people who needed correction, over 2/3, 66 to 70% of people were not corrected. That's one. The second was, we looked at, for example, the report from Brian Holden, which said myopia, for example, in India was 20% 2010, is going to go up to 50% by 2050, myopia. The third is, even when you look at the current scenario, we have people over 45 years old with the presbyopia, because generally people over 45 end up needing a reading glass in near vision, was close to around 350, 360 million people, out of which, the number which you had, 150 million people didn't have a correction. And the other point which you mentioned about the population, the intensity of the population, 63 towns in India with a population of more than 1 million only adds up to 12% of the population. So we said we need to have a program, not just going and doing an eye scan, walking to a camp, going away. We wanted to do a program which is scalable, repeatable, and which can really make a big impact. So what we found was access to eye care, a vision center, was a huge problem given the population intensity in a small bunch of towns. And to Piyush's problem, awareness. People didn't want to go out, which is when then we said, if you want a repeatable program, let's work on a program which is long-term, which is when we started this program of iMitra. Now, how iMitra works out is we work with partners, and these partners go out and scout for people because unemployment as well in smaller towns, rural areas is an issue, right? So we said, let's start looking at recruiting entrepreneurs. We train them for 6 months, theory, practical training, and we do on-the-job training for another 6 months. We end up, on an average, we end up spending at least ₹1,00,000 in training an entrepreneur. And we also equip them with basic refraction kit. And then we follow up with marketing support. How do they start marketing themselves? So now in India, we have close to around 9,500 entrepreneurs who have created access for 240 million people in India. 240 million people now have access within a couple of kilometers they could go for a correction. And the number runs into several tens of millions of people who have been corrected. This program has been replicated globally with close to around 30 million access points, covering 900 million people. So through this, through the foundation, through this, what we've done is, and also what we realized is, through the foundation and mission, we didn't want to focus on one particular problem of presbyopia. What we realized is, you need to have a holistic, refractive, correction. Because as I mentioned earlier, myopia is a massive problem. So if people who are now 20s have myopia problem, they go to 45, they're not just going to have a problem of presbyopia, which is they can't see India, they can't see distance as well. So it has to be a holistic program. So we believe in a holistic program. And to give you a data point, it does significantly impact people with presbyopia. So our foundation globally has equipped now close to cumulative 85 million people. And this year we're going to equip 14 million people globally. And our data shows both in India and globally, 50 to 55% of people get a reading glass or a bifocal. So by doing a comprehensive myopia/full refractive correction, we're also impacting people with refractive errors. Now, coming to your point in terms of scalability, right? How do you take it to 100,000? A couple of factors which need to be addressed. The first is, in all these smaller towns, there's still a preference for a steady job. While an iMitra on an average probably would make $25,000-30,000 minimum opening a shop. So in fact, some of them opened 3 shops. They started a chain of iMitras. But the first and foremost is how do you get them motivated to, our retention rate is still very high, but how do you make them motivated to stay? That's important. The second is for scalability. Of course, we as an organization have made a big impact, but far more needs to be done. So we need more, I would say, training partners, probably partner with Peyush's foundation, but we need to partner more and have more training partners. The third is, while we put significant capital up front, cost of running a business, they need $1.5 for working capital and so on and so forth, which again is a sort of hindrance. So if these 3 factors are taken care, I think this program can significantly scale up.
And Nara, can you talk about the profile of these iMitras? What kind of people are there? What's their socioeconomic background, education, and so on?
These people can be, it doesn't matter, right? You go to rural area, when you start scouting for these people, they can be school dropouts, they can be high school, it can be, we have a lot of females as well, by the way. So it can be any profile of people who are willing, who have the motivation to make a difference. So that's what we look for. And we give them all the training.
You don't need a degree in...
Nothing specific. We just give them... And in fact, what we also do is we have a panel of 25 optometrists. There's also an opportunity to do remote as well if they want to validate. Yeah. So we have 25 panel of optometrists. We also have invested in some gadgets to help them do a remote refraction as well to validate.
Yeah. Okay. Awesome. Thank you, Nara. So, Ella, I know that you are drafting an MOU already. So, can you talk about your experience, how civil society, market players, and government can work together? Maybe your work in India and abroad. If you can talk about some of the successful examples where it has worked and something which we can replicate.
Yeah, great. So one of the biggest issues with eyeglasses is it has been locked up in the 4 walls of hospitals and optical shops. And it has been the domain of doctors, optometrists and ophthalmologists. We need ophthalmologists and optometrists, but they are not the only ones who can help to deliver eye care. So one of the most important things that has been done in primary care in general and in maternal care is task sharing. We know that community health workers can find people who have diabetes. We know that community health workers can be responsible for identifying malaria. There are tasks that lower level health workers, whether they are a pharmacist or a nurse or somebody, an ASHA, that they can get involved in the vision screening and identifying people with presbyopia. They can dispense accurately reading glasses, and they can refer people for higher level eye care. Imagine if all of the millions of ASHAs in India had as one of their government-approved tasks that they are allowed to do is identify blurry vision and get people an immediate solution of eyeglasses, for reading glasses, spectacles, or refer for another eye condition, how much coverage we could have and how quickly. So as we think about, and for those who have traveled in Europe or the US or Australia, you will know that you can get reading glasses in a pharmacy, in a bookshop, in a gas station. They do not need to be stuck in optical shops and in pharmacies. I'm sorry, optical shops and in hospitals. What if all the Kirana, what if all the mobile phone sellers had reading glasses? How many people are locked out of the digital economy because they can't read their mobile phone? How many people are turning their phone over to the person who's doing the top up because they can't read the PIN number, or because, for their mobile banking? So the first thing is, it's got to be multi-sector. So we're so excited to be here at Charcha because this is a livelihood space. So how many people are working on microfinance or microlending? Some. How many people are working on rural livelihoods? Great. How many people are working on farmer productivity? Great. How many people are working with artisans? Super. Congratulations, you are now our new allies. We will be signing MOUs with all of you. We are going to enlist you because your success, why do you do the work you do? Because you're trying to increase farmer and artisan and income, and having people have a greater chance of a path out of poverty. So this solution is one that needs everybody. It is not an eye care problem, and it is not a health intervention. I'm going to say it again. Eyeglasses are not a health intervention. They are a livelihoods, education, and road safety intervention. Don't get in a car again or a bus without thinking about whether your driver needs glasses. If you got a delivery from Amazon, did your driver have the glasses they need? I can tell you that 25% of the truck drivers in India are failing their visual acuity requirement for glasses, for their driving license. 25% of the millions of truckers on India's roads need glasses. So this is a multi-sector approach. So the role of civil society is that we all have a role to play. Now the other part is for government. Government in India is amazing for lots of things. You guys did such an, like polio and COVID and vaccines, and so the machine is real. Whether it's a demand generation awareness machine or a delivery machine. But one of the most important things that government can do is create an enabling environment for the civil sector and the private sector to thrive. So there are three things that are really needed. One is the government needs to create clear guidance about who is allowed to do what. It is not clear about who is allowed to dispense reading glasses right now. And so that needs to be made more clear. There can be a reimbursement. So for cataracts, there is a fantastic reimbursement policy for eye hospitals for cataract surgery, which has led to the boom of eye hospitals across India and remarkable achievement on reducing blindness. That was because the government created an environment where hospitals could get paid to serve the poor. The same thing can be done with glasses. And then the final thing in terms of an enabling environment is making sure that eyeglasses are part of the primary care package. One of the biggest issues is that we don't have vision correction down in the primary care level. It is not the task of the ASHA, and it is not in the primary care posts. And so these are really important things that the government can do to create an enabling environment for civil society and for the private sector to thrive. And then I would say the final thing, and I just want to go to something that Peyush said, which is there is manufacturing happening in India. Vision Spring sources from 3 manufacturers in India. We proudly like to say made in India, made for the world. And we are exporting this year to Africa. And you're exporting in multiple places. So the capacity exists in India, but it does need support, and it needs support on the quality side. The final thing I want to touch on is this idea about making money. Making money is not a bad thing. Some of us in the NGO sector get a little squeamish talking about profit. We get a little squeamish talking about margins. We get a little squeamish talking about money exchanging hands between low-income people. People will pay 1 to 2 days' wages for the immediate benefit of vision correction. Why? Because they are going to be able to work and care for their families. People need jobs. This is what's so great about the iMitra program, is it is possible for people to earn income selling eyeglasses. There will always be people who need eyeglasses for free. We have the red card, and there are places for that. India's very clear about how to do that segmentation. But we don't want to be allergic to selling. And so what we want to be able to do is say, if I run a pharmacy or a Kirana or I'm a health entrepreneur, 30% margin. You should get 30% margin on the 100 rupee glass or the 200 rupee glass. And if it needs to be subsidized to make sure that that margin comes down or that commission comes down to the person in the village who is doing that job, great. Because we need people to be able to make an income solving this problem. And that is where the incentive comes from.
Thank you, Ella. Ella, one quick question. So you made a good point about community health workers. So in India, there are about 1 million ASHAs. But one thing which we hear is that ASHAs are already overloaded with work. And then we add another task to that. Is that even a sustainable and scalable model? So are there any ways to ease the burden for ASHAs? And alternatively, do you see that are there other government departments where there's a potential for partnership and using their cadre?
Yeah, great. So just to put it into context, Vision Spring started training community health workers in 2002 to do this work. And in Bangladesh, there are 23,000 community health workers who have already screened the vision of 10 million people, and they have sold reading glasses to 2 million. They are carrying eyeglasses as a margin positive item in a bundle of goods and services. Now, the only issue with ASHAs in India is ASHAs don't have a supply chain underneath them. They're really more about education and awareness and directing people to the care they need. So I think it would be unreasonable to expect that we're not going to transform ASHA's jobs to be able to just deal with this one problem. But the screening for presbyopia is so simple. It's almost as easy. It's like a thermometer. It's almost as easy as teaching somebody how to use a thermometer. So there is a question about how much they can be asked to do, and I think we have to do some more experiments and tests in India for what is reasonable. But we also know that there need to be eyeglasses specialists in the cadre floating around. Because we know that to support this intervention, you do have to have specialists kind of in the fleet, so to speak.
Got it. Thank you. Abby, let me come to you when it comes to, again, using innovative ways for distribution. And I know that LIF has done a lot of work in Africa and in many other developing countries. So what has been your experience? What are the many innovative channels which you have used and that has worked? And what has been the key success factors for those channels to be effective? And maybe if you can elaborate a bit more about how important is trust in these distribution channels to be effective.
Absolutely. So we work in about 12 countries. India is one of them. We work with 16 different partners, including Vision Spring and the Nudge. And we have about 40 different pilots running across multiple different channels because we want to understand how to hack it at the last mile and really what is that customer journey. So what is, how do we provide the right information at the right moment for someone to both be open to selecting the product and using it for many different purposes. And then hopefully when the diopter or power no longer works, they go and seek out another one. So we're testing it at pharmacies, many community health workers, entrepreneurs in different communities, both tied to other products or sold, as an individual product. We're testing it through religious institutions and community health centers, primary care clinics. We're sending them out with solar providers because one of the barriers to payment, as Ella was speaking to, is many times the older individual in the household who might have, adopted the solar product and is paying it off incrementally can't actually make the payment. So they wait till their young individual comes home to make the payment for them. But what if we give them reading glasses so they can make the payment? And what if they use light more frequently so they top up on the product or pay down the asset sooner? Could it de-risk a whole asset financing portfolio? So we're trying to test out new incentives and approaches who's already there at the last mile, able to effectively bundle it and provide it. One thing that's great about glasses is it's very simple to learn how to use, it's very safe, it's shelf stable. The better pairs can last for many years. I had a glasses supplier throw a pair against the wall, and they were about 60 rupee pair of glasses, and they didn't break. So it's a pretty durable product. Someone told me if we just make them, the glasses case, the same size as a bottle of Coca-Cola, we could get them on trucks. If Coke is everywhere, glasses should be everywhere. So those are a number of the channels. But we do realize because of all these misconceptions and concerns about harming the eye or degrading one's vision, people want to go to get their first pair from a trusted counterpoint or agent. So we're seeing people pick them up in pharmacies, but then once they understand these are safe, harmless, their power will change, they're willing to purchase them elsewhere. Or they want to pick it up from a religious leader who's probably already wearing spectacles. And he says, I have them, you should too. Or maybe they want to get them through an employer or a place of work or a health provider. So we're thinking about how someone gets their first pair may not be how they get their second pair.
Great.
Wait, one last piece.
Yeah.
One thing we're also realizing is health workers need them too. So I spoke to someone who did the largest trial on better birth outcomes, and they said actually a number of health workers couldn't see the thermometer or blood pressure cuff, so they weren't catching preeclampsia earlier, which was leading to higher rates of mortality. So this is a tool that could save lives, increase productivity, and should be as standard as Band-Aids in a health kit.
Nara, I'll come to you. SLR has been doing quite a bit of work with state governments also. I know that you've been working on this Asha Kirna program in Karnataka, starting a program in J&K, and in, I think, Kanti Velugu programs also, SLR has a contribution. So can you talk about your experience working with the government? What has been the model? What do you provide? And what's the replicability of those models across the country?
Yeah, absolutely. This, if you want to make an impact in India, you need to have a public-private partnership. Without that, it's not going to work at all. So before we launched into working with state governments, what we said was, you need to start thinking what is the strengths or what, as an organization, we bring to the table, and what can the government bring to the table, because it's important to have a very focused approach. Otherwise, you can't just keep shooting everywhere and trying to make it happen. So just to give you some examples of what we've done, we partnered with the government of Madhya Pradesh and Orissa, and to the point of Ella, right, around 150,000 primary health centers exist. And a lot of those health centers don't have the ability to do a basic vision correction or a vision check, for example. So we picked up Madhya Pradesh and Orissa, leveraged our imitras as well, to start ensuring that a lot of their primary health centers can also help with checking the basic test, acuity tests. That's one. The second, what we did was the one in Telangana, the Kanti Velugu 1.0 program, which we participated in. Their approach was different. We were the technical partners working with the government in terms of technical support. We were the partners to help them, to your earlier point about supply chain, because that's important, supply chain. And we provided very, very affordable glasses, its readers, its prescription lenses across the board, in huge numbers. And they covered 30 million people in the 1.0 program. And then talking about Karnataka, which you mentioned, what we did was our large lab is in a taluk called Dodbalapur. Now, we picked up that taluk as an example years back and said, and now the taluk is completely, there's an elimination of vision error in the taluk. Then we picked up that example and said, how do you scale it now? And now we're working with the Asha Kirana program, and we're also helping putting a model to train the Asha workers. And now they're having a target of 15 million people. And lastly, and more recently, we worked with the government of Goa, where we've supported the training of 2,400 teachers. We said earlier, the Asha workers are stretched and strained. We said, why don't you start screening children, school children? And to do that, we train teachers to do a basic check of how you can find an error in a child. And they've covered now 230,000 kids across Goa. And we have an event actually next week for the closure of this. So what's important is not just to go back and do a screening and come on, government, let's do a screening. Start to work with them, start to educate them on what works, what is scalable, and leave behind a program which is scalable and repeatable. So that's what we have done, and we are expanding significantly. And this comes from our foundation, One Side SLO Exotica Foundation, where I'm a director on the board.
And Nara, in these programs, who is funding the pair of eyeglasses? Is it the government who is funding the pair of eyeglasses, or?
No, it's a combination. In fact, a lot of governments also fund. In fact, they want to buy.
Yeah.
Even if you take the amount of money available in the National Health Mission and so on, there's a lot of unused funds available. Significant funds is not being utilized at all. So we have a combination. Our foundation also steps in where required to support, for example, what Ella mentioned about truck drivers, right? We also participated with Site Saver, Dr. Montis here. So, we give out, glasses free. Plus, there's a combination also the government wants to buy, but at good affordable price point, which is available. Be it reading glasses, be it entry-level progressive lenses, everything is available at a price point. It's a combination of free, a combination of paid, and what Ella mentioned over our chat as well, there has to be skin in the game, right? So you also collect some money from the people who are getting screened, a couple of 50, 60 rupees. They also have ownership in maintaining the glasses.
Got it. Let me come to you again, Peyush. So technology has been the linchpin of all the great work Lenskart has done. How do you see technology playing a role in solving this problem for this target statement?
Yeah, I think since I am the youngest person in this panel, I think I have to do something different than what everybody is doing. See, firstly, I think technology has a very large role to play. I do feel that if on WhatsApp one could identify that they need a reading power, the problem of identification can be solved. Because I see my wife who runs the foundation, she tells me that I have made 500 villages vision correction free, and I'm being the tech guy, I'm thinking, acha, congratulations, but why can't tech do this? So I do think that eventually vision correction, vision detection is going to move to mobile, and globally work is happening. Myopia is a little difficult. I'm assuming reading is slightly more easier. Reading is actually far easier than myopia. But let's not forget that for kids and the teenagers, we also need to worry about them. And myopia is also not a small problem. So I do feel that technology, and we are getting there because all phones have distance camera now, so you can detect distance. We had invested in a company sometime back in Israel, which was bought then by another American company, which had almost solved vision correction on the phone. And now we are running 3 different projects around this. And like I said, we have been so focused on myopia that, presbyopia, but I do feel that is going to make a very, very large difference. In my view of the world, as long as the government can clearly specify and understand that we need optometrists, but not for every vision correction exercise. But that's my biggest fear, because in a lot of countries, because of full knowledge or full information, laws are made around, like Japan today doesn't have any such rule, and it is one of the developed economies. You can get out of the school, somebody can train you, and you can do vision correction and dispensing both without any barrier. And I'm sure they know all the rules. As long as that is there, I think market in India is huge. One can build distribution. If ITC tomorrow wants, they can make a reading glasses available in every corner of the India. And like Ella mentioned, there is margin in this business, right? So it can be a profitable enterprise. So the way at least I see is a 3-pronged approach. One, technology helps in diagnosing and detection, early detection. Second, distribution building is happening in India, can happen in India. We do it with shampoo, so why not we do it with glasses? And we have a lot of great FMCG examples of what is happening. And the third, which I think will be important, is to make glasses cool, right? Because I do feel that the more we try to make people think of this as your prevention of blindness, or upgrading your work life. If we just said, okay, these are the Rajnikant glasses which are available for 100 rupees, I think you can cover one state in India easily, and everybody will queue up rather than you are having to chase them. That may be the secondary benefit. Vision correction, the primary benefit may be the driver. So I think we need to get to that innovation of making them really cool, because people buy a phone because of the camera, people watch movies. So we need to get it out there, and if we get it out there and it's available in distribution and they can detect their power, we should be done. As long as the government is supportive on this. I'm worried that someday they'll say only optometrists can do this, then all the plans can go for a toss.
Can I know we're shifting to questions, but if I can just say one thing, which is part of the cool factor is people need to have choice. We cannot be handing out black glasses and assume everybody wants to wear them. People need sparkle, they need gold, they need color, they need shapes. So no more black glasses for the masses, and we're going to offer the dignity of choice as we solve this problem.
Thank you, everyone. It has been a fascinating discussion. Time is up, and there are many questions from the audience. In the interest of time, I'll take one of those, and I'll request all of you to maybe take a minute to give your concluding thoughts. So the question is that the rapid growth in glasses production, what are the environmental implications of that, and how do we think about that? If we scale the production of eyeglasses, do we see any adverse impact on the environment? Or when we are thinking about scaling production, are we taking into consideration that we are doing it in an environmental friendly way? So maybe Peyush, I'll start with you.
Look, every manufacturing exercise will have some impact on the environment, but today there are means to balance it. You can build factories which are zero water discharge, so you can manage water. Similarly, at the pollution, all different levels of pollution, the materials available today are biodegradable. I'm not saying you have to, one is, of course, you can use recycled materials, but you can use materials. You don't have to necessarily use plastic. We have been doing this in India for ages. We don't use any plastic in any of our frames. So I think it's doable. I don't think it's different from any other product. I don't think that to be the barrier. And it's not like eyeglasses are only made from a material which needs, which can't be handled. I don't know if you have different views.
And as well, there are also a lot of regulations now on plastic waste and so on, recycling targets and so on. So there's a lot of initiative happening as we speak in India of people focusing on, taking back those eyeglasses, recycling them. That's happening. If since we are a global organization, frames as well, a lot of our frames have bioacetate now. A significant portion of the acetate has bioacetate, which is more environmental friendly. So there is a lot of awareness of trying to be true to the environment.
Anything to add, Ella?
Yeah, I'd like to build on the idea about the production. Vision Spring has a lens lab in Noida. We produce 25,000 pairs of prescription glasses a month, and it is India's first solar-powered lens lab. So we can think about how we green our supply chains. The other issue is, why do all the frames have to have plastic dummy lenses in them? They don't, so you would take them out. Why do all the glasses need to be in a plastic bag? So we're trying to figure out, so if we're 150 million tiny plastic bags into the communities, right? That makes me nervous. I imagine it, then it's going to be in the river. So how do we transition what the glasses are packaged in to something that's more biodegradable? Little things like our boxes, right? The boxes can all be made from recycled plastics. So there are things that we can do in the production to try to reduce the environmental footprint, and I suspect there are people in the room who can help us do that.
And just to add as well, in Italy, as for example, all the manufacturing and a lot of countries across, we want to be carbon neutral by 2025.
Yeah. And besides, this is not a single use. This is something which lasts at least for 2-3 years. So it's not that it's a very, single use plastic which you throw away like a plastic bottle.
Yeah, and for some, if you need to if your frames are sturdy, you can actually get new lenses put into them.
Yeah.
If they have.
Or,
if you don't want
or
a new
you can
fashion
give them
item.
away for someone in need and get a new pair.
Lovely.
We do actually often see what we call like the family glass, right? It's like the magnifying, the reading glass that gets passed around the family. Yeah.
Lovely. So let's wrap up the session. So Abby, any concluding thoughts or call to action for the audience and the other players in the ecosystem?
Yeah, if you're all in livelihoods, first think about what are all the near vision tasks the beneficiaries or the individuals you serve are navigating on a day-to-day basis. Whether it's from farmers not spotting bugs early in harvest, so they're losing crops, or whether it's drivers or seamstresses or individuals in their home who can't cook or create safety around cooking because they don't have glasses. So really think about your life, all of the near vision tasks you do, and I'm sure the beneficiaries or individuals you serve are doing the same. And then think about ways in which you can provide access. Crop input stores, as people pick up seeds and fertilizer, should have glasses. Different touch points and access points can have them. What's also great about a shelf-stable product is that, and a long-lasting one, readers can last 2 to 5 years, and if they don't work for the individual, and if they're still good, they could be passed to the next individual. So this isn't a frequent purchase. This is something that can last in your communities for years if you provide an infusion of it. So think about near vision tasks, access points, and how you can bundle it into your services and provide them effectively.
Lovely. Thank you.
So I want to go back to something that Abby had mentioned at the beginning, which is the idea of saturation. If 500 million people need eyeglasses in India and don't have them yet, you kind of everywhere you look, somebody needs glasses. And so we could sprinkle glasses around India like fairy dust. And we wouldn't actually change we wouldn't solve it. We wouldn't change the root situation because we won't have normalized eyeglasses wearing. So I want to come back to the point about this idea of coverage rates. In the majority of the communities that we're serving, whether it's coffee or tea or artisan or the garment sector, 80% of the people who are getting eyeglasses through our programs are getting them for the very first time. So what we want to do is we want to think about, that's a huge backlog, and we have to catch up. So we need to really concentrate. One of the things that has happened at the global level is that at the United Nations, there has been an agreement that eyeglasses are a driver of multiple sustainable development goals. India has signed on to a target to increase eyeglasses coverage rates by 40%. That means that in the communities that, like the ones that Nudge has identified through this really important report, which I want to say thank you to the Livelihood Impact Fund for helping be the stimulus on. In the communities that we are all serving, we are looking to go from 20% eyeglasses coverage rate to 60% eyeglasses coverage rate by 2030, as part of the achievement of India's the Sustainable Development Goals and India's human development gains. And the government has agreed. So we can now be part of spreading that word and saying, let's look for saturation. Let's look for the early adopters who need eyeglasses to increase their income and to improve their livelihoods in their home. And then we will go from push strategies to that demand pull, if we concentrate.
Thank you, Ella. Nara?
Look, from my perspective, what I mentioned earlier to the first question is, the key is access creation and awareness. I think that's extremely important. And no one organization, while each organization we feel we are making an impact, but no one organization can solve the problem in India. It needs I would say the Peyushs of the world, the Zeiss of the world, everybody has to come in, get together. I had a side chat with them as well earlier. How do we get together to make a significant impact? And to the point mentioned by Ella, as part of the SPEC 2030 WHO, India has signed up to increase the penetration by another 40%. Until now, it was always, India has so many problems, health problems, right? But now signing up to this target of increasing from 30-odd% to 60-odd%, you're going to have a lot more engagement with the government. I would take an example of, two examples I would say. If you take the mutual fund industry now, you get bombarded with a lot of SIPs and so on. They're all getting together. Why can't we get together and try and drive awareness? Or what the RBI does on financial frauds and so on. So a lot of things here and there, but working together is what is important. Ultimately, a holistic check on eye, along with access creation and awareness, is the need of the hour.
Very well said, Nara, and people on this stage and many in audience. I guess these are the people who can do it at scale. Peyush, any concluding thoughts?
See, I think this problem is quite old now, and technology is even older, and there's a lot of things that are happening in India for the first time. I think it's time we fix this, and there's so much. I mean, we have done this before. We did it with polio. I think when we get to it, it just happens. I think awareness is growing. Awareness was this category, at least I think in urban India, has grown significantly in the last 10 years. So there wouldn't be, I don't think that we have any missing piece at this stage. So we can drag it or we can solve it at this stage. And it's solvable. I think we have solved a lot of things. I mean, we get stuff in 10 minutes at home. So these days, and so I think we as a country can solve this. Like many other problems, the time is now. We have to get up, and this is, I look at the entrepreneurial ecosystem in India. There is so much to do in this area that people can bring. Somebody can start just an FMCG business on reading glasses. Somebody can start this. I am going to put a team now to do a cool, affordable reading glasses from Lenscraft.
Lovely. Right, that's all.
So, yeah, I think we got to get up. We have been sleeping. Yeah, that's it.
Lovely, thank you. Thanks, everyone. I would like to thank everyone on the stage, not only for this panel discussion, but also to help us in this study. Whatever we have compiled in this study, it was not possible without help of these organizations and leaders on the stage. I do also want to call out site savers, and R.N. Mohanty somewhere in the audience right there. I would like to thank Peyush Khetan and Kier Netram also. They helped us a lot. And of course, Swadesh Foundation. So thank you very much. Thank you very much for your time.
Thank you, Amit. You've definitely seeded, I think, this session with a lot of optimism and enthusiasm about this being a problem that can be solved pretty much by the people in this room. We leave with that. Thank you to the panel for very deep insights, and thank you. Please. To the audience, we will now take a 10-minute break, and then we'll see you back in 10 minutes for the next session, which is titled Sunsetting Extreme Vulnerability by the Gates Foundation. See you in 10.